Hello everyone. We are here today to talk about depression and suicide. We will be presenting information on recognizing the symptoms and warning signs, discussing the causes and how prevalent it is, and share with you intervention and prevention strategies for you to apply in your own classrooms. First of all, how do we discern depression? The Mayo Clinic describes depression as a mood disorder that causes a persistent feeling of sadness and loss of interest. It affects how you feel, think and behave and can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities, and sometimes you may feel as if life isn't worth living. It can be an all-consuming problem that traps you in its grips and refuses to let you go.
There are a variety of symptoms that you may see in your students. They can occur at any time and last for a short time or for even longer periods. It is important to have a close working relationship with students and be able to recognize these symptoms to better help your students. The symptoms may include difficulty concentrating, remembering details, making decisions, and being productive, trying to accomplish something. You may notice decreased energy, exhaustion, inability to move, get off couch or out of bed. Your students may have feelings of worthlessness, helplessness, guilt, hopelessness, pessimism, empty feelings, sadness. They may fixate on past failures or blaming themselves for things that aren't their responsibility. You may notice excessive sleeping or excessive awake periods. They may be irritable, restless, anxious, have angry outbursts, excessive frustration even over small things. You may notice students overeating or appetite loss, which may lead to noticeable weight gain or loss.
You may notice students complain more about pains such as headaches, cramps, stomach ache, backache, and their symptoms aren't relieved with treated. You may see them lose interest in participating in life, such as activities or hobbies that once was pleasurable. On the extreme end, you may notice or see your student thinking about or even attempt suicide. Depression is serious and left untreated could end with your student trying to harm themselves. Seek professional help. Don't try and help the student on your own. There are trained professionals more capable of helping your student. Do make yourself available and a safe place for your student to go and talk, but ultimately seek the school counselor or other health professionals. Sally, will you share with us specifics that apply to students you may work with?
According to Mayo Clinic, symptoms in children and teens can appear differently than adults. In younger children, symptoms of depression may include sadness, irritability, clinginess or aches and pains, refusing to go to school, or being underweight. In teens, symptoms may include sadness, irritability, feeling negative and worthless, anger, poor performance or poor attendance at school, feeling misunderstood and extremely sensitive, using drugs or alcohol, eating or sleeping too much, self-harm, loss of interest in normal activities, and avoidance of social interaction. And are there different kinds of depression we need to be aware of?
Yes, there are different types. It is important to know that anyone or many of the symptoms mentioned may be present at any time. It is so important to know your students and be aware of their norms. The different types of depression to be aware of include major depression, persistent depressive disorder, dysthymia, bipolar disorder, seasonal affective disorder, sad psychotic depression, postpartum depression, premenstrual dysphoric disorder PMDD, situational depression, atypical depression, and serotonin syndrome. Sally, what are some of the causes of depression?
With most mental disorders, it is not definitely known what causes depression, but the following may be factors and can be a combination of factors: biological difference, brain chemistry, hormones, inherited traits, genetics, abuse, certain medications, conflict, death or significant loss, major life events such as new job or loss of job, getting married or divorce, serious illnesses, substance abuse, social isolation or family turmoil.
It is hard to accept that as teachers we can't fix a problem with our students. However, there are things we can do for intervention and prevention that we can apply in our own classrooms. We need to know the signs of depression. We should be approachable, a good listener, and available to all our students. We need to teach students the skills to problem solve and positive coping skills. For ourselves, we need to know your limitations and be able to encourage students to seek help and refer them to appropriate services.
And you mentioned earlier that left untreated depression could lead to more severe problems such as suicide. What is the definition of suicide?
Suicide is the act or an instance of taking one's own life voluntarily and intentionally. There are risk factors that as educators we need to be aware of. Family history of mental disorder or substance abuse, prior suicide attempts, violence, physical, emotional, or sexual abuse, chronic pain, incarceration, and exposed to suicidal behaviors of others are some of the risk factors of suicide. Sally, can you share with us some of the causes that may be associated with suicide?
Over 90% of people who die by suicide have a mental illness at the time of their death, most commonly depression according to suicide.org. Other causes may include untreated mental illness such as bipolar disorder, schizophrenia. Suicide thoughts or attempts may be triggered by a negative life event such as death of a loved one, divorce, breakup of a relationship, losing custody of children, serious loss such as job, house or money, serious or terminal illness or accident, chronic physical pain, intense emotional pain, loss of hope, feeling taken advantage of, not being accepted by family or friends, bullying, and low self-esteem. There are some warning signs that we need to look out for. Those include fixation on death, clinical depression, trouble eating or sleeping, losing interest in things once cared about, tying up loose ends, saying things like "it would be better if I weren't here" or "I just want out," talking about hurting oneself, and saying goodbye to people.
According to WebMD in 2009, suicide was the 10th leading cause of death in the U.S. There were 37,000 suicides, and 1 million people attempted suicide, according to the Centers for Disease Control. Studies show that men have a higher rate of suicide because women account for the majority of attempts. 20 to 50% of people who commit suicide have had previous attempts, according to the American Foundation for Suicide Prevention. For more specific details on the prevalence, go to the following site, http://www.suicide.org/suicidestatistics.html number signed with rates.
When you suspect a person may be struggling with mental health issues or suicidal thoughts, seek medical help. Don't try and fix the problem yourself. There are better trained individuals to help people who are suffering. It is important to be supportive and a good listener, but you are not in a position to fully help them. The number one cause of suicide is untreated depression, so to help prevent suicide, seek medical help. Here are some steps to follow when helping a person who may be suicidal. Always take suicidal comments very seriously. If it is an emergency situation, always call 911. Try not to act shocked and don't try and handle the situation by yourself. Listen to everything that the person has to say. Comfort the person with words of encouragement. Don't try to solve their problems. When appropriate, let the person know that you are deeply concerned and care about them. Do not leave the person alone and wait for help to arrive. Don't be judgmental. Be careful of that statements that you. I remember you telling me you had an experience with a student who suffered from depression and harming herself. Please share with us.
This year I worked with a new transfer student that had some mental health issues that was not reported until a rumor that an ambulance was called to her home because she was cutting herself was going around school. We, the school, didn't know officially until she took some pills in the girls' restroom. It was more challenging of a situation because we were playing defense and reacting, not be proactive. The girl's mother didn't want us to know about the girl's history and was hoping with a new school the behavior would go away. After figuring out there was a problem, we got her set up with our school counselor, verified her for resource services, and the necessary classroom support. For my student, the behaviors were based on depression but also the need for attention. Whenever she would have an episode, her mother would take her out of school for a haircut, new clothes, girls' day, or other special activity. The cutting was very superficial and a band-aid would fix the problem. It was scary to deal with. But once we figured out her needs, we were able to help her. This turned out not to be an easier fix than it could have been. For the school, I did morning and afternoon check-ins with her and homework assistance and accommodations. By the end of the year we went for months without any episodes and her 5 failing grades were now in the BC range.
Thank you for sharing your experience. Why is it important to know and understand depression as educators?
We are supposed to teach all students at all levels, from all backgrounds, with all different factors that affect their learning, and we are supposed to help them find success. It becomes less challenging to help a student when we have some understanding about what they are going through. A student who is so depressed that can't even get out of bed is probably going to miss a lot of school, or if forced to go to school isn't going to be productive and their learning will be hindered. we are obligated to try and help them. There are resources out there with information to further assist you with understanding and give interventions to try with your student. Please go to my Google Slides presentation for more resources and couple great videos to further explain depression and suicide. Thank you for watching, and we hope you learned a lot of helpful information. All sources will be cited on Google Slides.